So, for the last learning objectives, we're going to talk about disaster planning and preparation. So, a lot of what happens with disaster planning is in the domain of public health surveillance. I'm going to talk a little bit about what that is and how some of the ways that can be, we can apply health informatics to that. So, the idea of surveillance or public health surveillance is that it uses health related data, and those data help in signaling the, probability of that there is a case or there's going to be an outbreak. And by signaling that the probability is high in cases where it is, then it means that there needs to be, public health response. Either it's going to be planned or it has already been planned ahead. And then when that happens, it gets to be hopefully seamlessly deployed. And it's very important that the data that is used to do the signaling or calculate the probability that the data is available, and that the speed of which the data is being exchanged with all the different people who are involved in it, in a situation where it's government agencies and different states and different health departments, for an example, that there is a seamless exchange of health data, and one that happens quickly enough so that it can deploy, do disease monitoring or syndromic surveillance. And if the system that is around or the data exchange is not seamless, or the data cannot be trusted when it's sent, it does have an impact on public health functions, because they may not be able to deploy some of the public health strategies or be able to sufficiently respond to the threats in the way that needs to be done. So, surveillance data systems such as the infectious disease trackers that collect data on adverse health effects, they're very, very invaluable for population health or public health, population health officials to be able to plan programs, to be able to evaluate the programs that have been planned or implemented, and be able to implement population health interventions. So, an example of a system would be this infectious disease tracker, which I've given you the link to. You can go click on that, just kind of to learn a little bit about it. Then we talk this link to the disease monitoring. This actually looks at how you use social media to monitor diseases, and how social media can become a tool to actually provide the data or to collect data about what's happening. You can use it to actually calculate, for those probability that I talked about. And then the syndromic surveillance looks at how surveillance happens more on a global perspective rather than just the US. So you can click on these three links if you're interested in knowing more about public health surveillance. So, a surveillance data system is just a networked computer system that is designed to use health-related data trends, and do all the things that I've talked about, predict the possibility of an outbreak, be able to detect morbidity or mortality trends in geographic areas. More or less, basically, at the end of the day, is to help in signaling that there is a need for public health response, planning or deploying, something that been planned before. So, syndromic surveillance can be, typically used to target investigation of potential infectious diseases, but it can also be used to detect possible outbreaks that is associated with bioterrorism. So, when there is early detection of possible outbreaks, then it's very, very possible to, early detection of a possible outbreak happens if there is a timely and complete complete data that is coming in and the system that is in place in the organization and hopefully agency that is responsible for it. They review the data very timely, very quickly, and they're able to investigate disease cases very timely, and they're able to follow the trend reports. These are all things that has to happen. Very, very important that the data, comes complete. It meets all the data standards that we've talked about before, and that whoever is behind the review does it well enough. And but we are getting to the point where there's a lot of new technology that is being used for data surveillance. An example would be the Internet of Things. You can click on this to read more about it if you're interested. So the Internet of Things is a new technology that is being used for disease surveillance, but it's not the only one. But it's one of those that I use one of the reasons that they are kind of being introduced and getting acceptance is because of how quickly the is able to reproduce or to do the trends, to be able to predict the trends. So it does well with timely investigation, and it helps in identifying data needs and helps in managing the public health responses. So in 2015, the Homeland Security actually published a national strategy for pandemic flu, and this strategy had three critical goals. It detects animal or human outbreak that could occur in anywhere of the world. It also, protecting American people by stockpiling vaccines and also being able to have the capacity to produce new vaccines. And then finally, preparing to respond at the federal, state, and local levels in the event of a avian or a pandemic influenza that reaches the US. So while the COVID was not a flu, when COVID came, it had quite a number of flu-like features in that's one would reasonably assume that this national strategy that had been in place since 2015 is something that could have been modified so that it can be effectively deployed for the COVID. So I'll leave you guys to think about it and tell me whether you think that there was any part of this, the national strategy for the flu that was deployed during the COVID pandemic. So I kind of want to hear what you guys think about that. So, how do we use electronic health record for public health surveillance? So, one of the things that the health electronic health record does is that the idea of it, or one of the potentials that it has, is that because of the widespread, I think there's no health provider in the US that doesn't have some form of electronic health record or so. It kind of provides the public health agency with very rich data of health data to know what's happening in different places, whereby if things are happening in terms of how quickly people are being diagnosed with some certain symptoms, it will be able to kind of signal, okay, something is going on here. We are seeing an elevated rate of this kind of symptoms being reported in hospital visits. So these are some of the things that some of the potential that electronic health record has in as a way of being enabled for public health surveillance. So what would happen with that if EHRs are fully deployed to use as a public health for public health surveillance, is that the record can automatically send patient information alerts from the point of care to public health departments when those reportable symptoms or diseases are encountered. The UK actually has something like that, because I know the UK has this thing, the as a way of tracking what's going on with the hospitals, but then it's in a way a little almost similar to what is happening with the EHR. The UK has this NHS, which is everybody mostly see uses NHS in the US, in the UK, sorry. So all the data that comes into NHS is kind of there and helps in deploying patient information alerts for some reportable symptoms, which is something that the electronic healthcare record can do in the US as well. So this public health enabled electronic health data can be bi-directional. This way, it's allowing public health information and recommendations for treatment to be accessible to patients at the point of care, as well as those alerts being sent when patients are being treated for those reportable symptoms. So, and this is from the health.gov that looked at how meaningful use of EHRs can work in the sense of promoting population and public health. So it says that one of the best ways to leverage on the benefits of electronic health records is to improve population and public health, is to achieve meaningful use. As part of the improved public and population health domain, stage one meaningful use requires to providers to submit electronic data to immunization registries and to submit electronic syndromic surveillance data to public health agencies. By achieving meaningful use, we can leverage on the benefits of electronic health records to improve public and population health. So this is where we stop for today's class, just kind of introductory to population health surveillance. So if you guys are interested in this, it's one of the things that is being covered under the population health management masters. So it's all part of all of this. So this is where I end. If you have any questions on the class or the assignments or anything that I've talked here that you kind of want to know or more information about, do post on the Q&A and I will answer your questions. Bye. Do have a lovely day.